not only are you worried left untreated that these cats can get a pneumonia, but this recurrent rhinitis you talk about, what is that?
So they often will have sort of secondary bacterial infections as well, which you can just never seem to get rid of. The actual nasal turbinates and things can be affected. So over time, the whole inside of the nose is abnormal. So once it's kind of dry and not correct, it just means that there's much more likely to be secondary bacterial colonisation of that, and you can just never really kind of get rid of it.
When is it that they sort of generally get admitted for, say, fluid therapy?
One of the things that's going to make them feel, well, a lot better really pretty quickly is intravenous fluids, if they're even just the slightest bit dehydrated. So if they're not eating and drinking, then we would tend to admit them sooner rather than later to try and get them feeling as well as they can, instigate the medications ideally intravenously to get them eating early on, because if you miss that boat, it's really hard then to get them rehydrated and started on their medications and things. You're kind of like, you're playing catch up then.
A very warm welcome to the Paws Effect Podcast. This is my best friend. For the listeners who can't see her, she's come all the way from Scotland. Very warm welcome from Edinburgh, where we started our journey as very good friends.
Good morning.
Good morning. And we are sitting here in Hillcrest Veterinary Hospital. You visited a long time ago, and we haven't seen each other for years.
Yep, 8 years ago since you came to the UK, and 15 years since we last came here.
That's mad. So now we're already planning when we're going to see each other, which is great. So we're not going to leave it that long, but it's been so nice to catch up, and I've just missed my friend. And I wish we could do this more. And we discussion sort of over wine about cases and life, and it's going to be a lot easier to keep in touch now that we've done that. So
yeah, there's a lot that we missed.
Yeah.
So it's been easier to catch up in person for sure.
Yeah. So for context for this podcast, I have had to convince my friend to join me today. There was a bit of a hesitation. I said, please, I was never going to ask you over WhatsApp or over a phone call to do this. I waited until you were here in person to say, please come on my podcast. You're a vet. You're a vet that practices in a small animal practice in Scotland. And the work that you're doing is quite varied because you're doing a lot of GP work. But you also didn't start your veterinary sort of path doing vet. So we met, obviously, as mature students at Edinburgh University, and you had done, what did you do before? So introduce to your background.
I did a zoology degree at Dundee University initially.
Yeah.
Thinking I might go and do research or something abroad. That was kind of my initial plan. Which was kind of scuppered when I met somebody who didn't want to go anywhere. And he decided to hang around, so did I. So
you've been still with Dave and have a beautiful child to add to the family. And then we met, and I've got to give some background to our first few days. In fact, I remember our days in the lecture hall in Edinburgh, and I spent a lot of my years in the UK getting used to the British accent, and then ended up at a Scottish university and not really understanding the accent of a lot of the lecturers. I spent a lot of time looking over at your notes going like, I'm sorry, can I just see what you're writing? Because I just don't understand. And one of the first things you said to me is, have you brought a piece? Have you brought a piece? And I was like, a piece of what?
I'm like, a sandwich?
A sandwich. A piece in Scotland is a sandwich. So a lot of laughter. Hey, that's what I remember back to our lectures. A lot of laughter.
That was how you survived, wasn't it? Laugh or cry.
Laugh or cry. And it certainly formed a great friendship over the years, which is we have been reminiscing about during our time together this trip. So Dawn, you did, after your veterinary degree, you went out and practiced as a small animal practitioner, but you still sort of had a thirst for knowledge. And what did you do afterwards? You love studying. I mean, it's one of the comments your husband made yesterday.
Yeah.
You love it, don't you?
Yeah.
You love knowledge.
Far too many years studying. I then went and did an internal medicine kind of qualification, which was sort of 3 years while I was still working full time.
And it's a master's, essentially, qualified for the master's.
Just because I felt like I wanted to know a bit more.
Yeah.
And I still feel like I don't know anymore, which is kind of how it goes.
Yeah. So our topic of conversation today is going to be around cat flu. What is cat flu, and how do you generally see it present in your consult room? So, sort of first sight of it, how, for example, does it differ in young cats and adult cats?
Okay, cat flu is what we would tend to call an infection caused by either Callice virus and feline herpes virus. So they could be together or separate. And certainly the symptoms are usually respiratory based. They can also have conjunctivitis, a fever, be off their food. And most commonly we'll see in kittens, often that have come from multi-cat households or from the shelters. They'll often be really kind of sneezy, snotty, wee kittens, poor kind of doers. Or often sometimes we'll see them, they'll just come in and they'll just be a bit snuffly. And you'll think, this has probably already been exposed to these viruses and where they've come from, and I can't now do an awful lot about it to fix it, if you like.
Yeah. It's something that generally makes your heart sink, isn't it?
Yeah,
Because
it's sad, especially when they're young, because you're like, they're probably going to have to deal with this longer term. Because certainly the herpes virus can come back out again, so regress when the animals are stressed or unwell for another reason.
So is this then when you would potentially see them as adults, or can they pick it up as an adult, for example?
Yeah, they can pick it up when they're older. Most commonly, if there is a period of stress or rehoming, or if they're in a multi-cat situation where there's increased risk of transmission through aerosol, or it can also be transferred on surfaces, fomites, from your hands if you've touched other cats that are unwell.
So, I mean, I've spoken about parvovirus. So are you saying in a similar way, you can actually walk this kind of virus into your household?
It's possible. I mean, it's more likely to be people that are caring for sick cats that have touched those ones and then touch the other ones.
Very much so. So, I mean, it's something, when we were talking about it, you say you don't see a huge amount of in your practice.
No, because we have a really high uptake of vaccination where I work.
So vaccines are just part of the yearly routine. Are you vaccinating yearly for these?
We vaccinate annually on a kind of 3-yearly cycle. So they get the 3-part vaccine the first year, and then they get just the Ducat, the different one, the second year. And that's plus or minus the feline leukemia vaccine, depending on if those are at risk, if those individuals are at risk from leukemia.
Okay. And you don't vaccinate against rabies then?
No, because the UK doesn't have rabies, the exception being for cats that want to travel.
Okay. So in terms of, I mean, you saw how my cats in my household live. I was discussing, in fact, Zena's walking around here on the floor, when her son was with us, that he used to jump fences and travel and do, obviously, as a male, carry or travel a far bigger radius than the female cats that tend to stick around at home. But do you have the same sort of situation in the UK? Are the cats do they tend to go out, or is it also the fact that they're kept inside more? What is the general sort of situation of your?
I think there definitely are some number of people that have like totally indoor cats. Like tends to be breeds like the ragdolls and these type of breeds that people let them out. They're more likely to get in accidents, and or other people might decide that they'd like them to be theirs. But yeah, there's a lot of people will let them out, and there's always the risk that they'll go further than you think or that you choose. Get involved in fighting, or obviously if they're not neutered, mating. And these are how a lot of these viruses are transferred. So
the ones obviously that are kept inside, very much lower risk of the owners potentially coming in. But do they still vaccinate? Is that something you would still recommend?
Yeah, we still recommend vaccination of indoor cats. We just wouldn't include the part that they can only get from situations that they won't be in.
Okay. So let's talk about a case example. You have an animal that comes in. You mentioned some of the sort of symptoms, but from a visual perspective, what are the kind of things that, say, owners may notice that might indicate that the cat has snuffles or cat flu?
Most commonly with cats, they'll be off their food. So if they're congested, they usually don't feel like eating so much. They might be a bit more reclusive. So again, when cats feeling well, they tend to just kind of take themselves away a bit. And they might be trying to stay warm or to get cool, depending on kind of what's going on. So, off the food, any breathing difficulties, increased respiratory noise, increased respiratory effort, snotty kind of nasal discharge, sore or inflamed eyes, discharge from the eyes. They're probably the main ones. Cats don't tend to cough with respiratory disease, so that wouldn't be something you'd expect to see.
That's interesting. And then from a clinical examination perspective, what are the kind of things that you are now looking for to confirm or rule out that kind of diagnosis? What do you do within your consult to sort of establish whether you think that this may be respiratory in origin?
Okay, typical signs owners might notice with cat flu. Early on, it might just be that they're off their food. They might not kind of behave normally. They might be secluding themselves. They might take themselves away. Lie about a bit more, just be a bit more lethargic. The owners might notice that they have a discharge from the eyes or the nose. They might be sneezing, kind of snotting out stuff. They might just be a bit quieter. There might be an increase in respiratory rate or effort. Those would be the main things.
Hey there, pet parents. It's Dr. Cara, the ultra pet vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why UltraPet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. UltraPet offers a 100% money-back guarantee. Try UltraPet's premium recipe for short-muzzled dogs today. They're obviously now concerned, so they bring their cat into you as the veterinarian. What are the typical things other than obviously taking a history? Because I know that, that's always part of it. Where has this cat come from? What is the origin? What's the vaccination status? But what are the kind of things that you are asking or doing to now sort of assess, firstly, whether you think it is cat flu, and secondly, whether you need to manage it with more aggressive treatment, for example?
Well, the majority of the time, you're limited to what you can do in the consult room. Obviously, finances play a part in that as well. So depending on how unwell the cat is. So if it's still eating, still drinking, still bright enough, doesn't have an obvious temperature, obviously you've done your full clinical exam. If I'm not massively concerned about its well-being at home, then we largely go for symptomatic care. So that involves just making them comfortable, so making sure that they, if they need their eyes and nose kind of cleaned, that's something the owner can do at home. If they're really kind of choked up, they can take them into a steam room. They can make that at home, actually.
Oh, wow.
Just by putting the hot shower or the hot bath on for a while and take them into the bathroom, they can help them breathe. It's usually trying to improve their appetite. So you can do that by picking sort of kind of tastier, stronger smelling foods. You can warm them up a little bit and encourage them to eat. You can give them decongestants. There is one that's licensed in the UK, which is just a kind of powder that you put in their food, but obviously they have to be kind of eaten for that. Give them that.
And any sort of anti-inflammatories or anything that you generally add, or any antibiotics? When would you add that to the mix?
If I suspect that there's secondary bacterial infection, so if the discharges are really purulent, so really green, yellow, if they're just generally more systemically unwell, particularly if they're already immunocompromised, either very young or they're very old, you might be a bit more conscientious with regards to making sure that this doesn't progress and become a secondary infection that's going to make them more unwell. We don't commonly use antibiotics initially unless we feel that it is bacterial. Yeah.
And what can it progress to, for example? Like what do you generally see if these are left untreated?
It can progress to pneumonia. They can end up with chronic eye problems. They sometimes will have like joint pain and things like that as well. Wow. Most commonly, even if it is treated, you will get a kind of chronic rhinitis. So I've seen a lot of these cats that, spend their whole life being snotty, which is a bit of a shame. It's a big shame, actually. And then we'll see the cats that have recrudescence of the herpes virus when they're stressed, and they'll come in and they'll often might just be kind conjunctivitis that they present with, like sore eyes. They can get ulcers. So they'll be uncomfortable for a long period of time, and you'll think this cat's probably had this virus like a long time ago. And you can do tests to check for these things, but often that's something that depends on what the owner wants to do.
From a financial perspective.
Yeah.
So what are the kind of tests that you can do or that you do routinely in a practice to establish whether something's viral? Are they blood tests? What are the kind of tests that you can do to?
Yep. So for cat flu, most commonly it would be a swab, either from the conjunctiva, the back of the throat, and we can send that away to test for those viruses. For other viruses, like for feline leukemia virus and feline immunodeficiency virus, we tend to do blood tests for that. So there's usually a combination of tests. For things like FIP, we tend to try and get, there's a combination of blood tests. The most, I think, accurate way now is if there's an effusion, so if there's fluid somewhere in the tummy, to take a sample from that and test on that.
Test the actual fluid.
Yeah.
And do these viruses tend to occur together? I mean, is this because these cats are immunosuppressed and they therefore are more susceptible to something like the herpes or calicivirus? So, like, how does, in terms of the transmission of it, are these cats that have come from, so they haven't been fed by their mothers or they've been hand reared? I mean, does that make them more susceptible to these viruses?
I think lifestyle factors and your start. Whether you've been vaccinated, whether you've lived a feral lifestyle. So if you are a stray cat and you've contracted FIV or FALV, and then you then are exposed to groups of cats outside, then obviously the chances of you getting these diseases are going to be higher. If you're then rescued and brought into another household, then the chances of you passing that on or picking it up because you're already immunocompromised will be higher.
I mean, and this is obviously a really relevant conversation for me, having just set up a cattery, because I don't think owners necessarily always understand why we insist on them being vaccinated and showing us proof thereof, because of the transmission of these viruses. You can expose like a whole cattery to the virus, and I mean the consequences. You were discussing something similar in terms of the risk even within the hospital of these patients being there. So how do you manage those situations?
Yeah, with difficulty. So if you obviously know a cat has any respiratory symptoms, you're going to keep that in quarantine and well away from your other patients. But the problem is, like we can have a cold starting and be asymptomatic. You can still pass that on even before there are symptoms. So this thing is obviously going to still be the case for cats. If you're vaccinated, then you know that the risk of them having those asymptomatic conditions are going to be so much less.
Yeah.
And therefore, they're not going to spread it. The problem being that they can spread it through aerosol. So unless you have a hermetically sealed, individual unit, there is going to be a possibility that you're going to pass that on.
Yeah. So I mean, often when you're not aware of, or if there's any sign, like those early signs of inappetence, whatever, it's best from a hospital perspective to put them in isolation so that you can just see whether some of the respiratory signs actually progress and develop.
Yeah. And the same thing, if you're to bring a new cat into your home, the sensible thing would be to keep them separate for at least 2 weeks to allow you to see if any symptoms are going to progress. And if one of them does have signs of cat flu, then you probably should keep them separate for kind of 3 to 4 weeks to make sure that they're not going to pass things on to each other.
Yeah. So let's use that. I mean, a lot of people like to take on new additions and bring them into the household. How can owners practically, other than trying to keep them separate, are we talking separate bedrooms? Are we talking how cautious do you have to be if you're going to take on a new addition in terms of when would you advise that? Let's say the vaccinations are out of date or they haven't kept up with the schedule. Would you advise owners wait a period of time after vaccinating their current household cats before getting a new kitten or a new addition?
Yeah, ideally you'd give time for the body to make an immune response, and then you would still keep them separate even when ideally in separate rooms. So separate litter tray, separate bowls, separate airspace. And then if you're touching them, to wash your hands between.
Okay.
It sounds probably a bit more hardcore than maybe it is in reality, but I've seen that happen where the other cats get sick.
And it's terrible. It is terrible. And it's terrible because, you made mention of it before. It's not necessarily that, they get sick and they get better. This is something that can become a chronic, recurring condition. Mm-hmm. Talk to us about why that happens. Why is it that this is something that kind of comes back during particular times?
Herpes virus in cats can be thought of a bit like the cold sore virus in people, where you'll have a bout when you initially get it, where it's usually quite bad, and then it'll heal up, and then it goes away back into the nerve. So it seems like you're fine, and then a period of stress, sunlight or cold or something like that will make it come back out again. So it's kind of similar to that the cats, it'll be in, once you've got it, you've got it. They may never have like bouts again, but commonly it will happen if they're stressed, so with a hormonal response that makes it easier for the virus to come kind of back out again.
Wow. And what are the kind of things that you would typically see as stressful incidents for a cat?
Yeah, so many things. Just about anything that you don't think is stressful can be stressful to a cat. So anything that changes. And obviously bringing a new cat in is probably one of the most stressful things to them. It's a territory thing. So it's also important to make sure that even once they're living together, that each individual has access to the things that they consider to be their primary resources. So their food, their litter tray, or access to outdoors, and that they don't have to directly compete with the other cat to get those things. I remember them telling about, the behaviourist telling us about a behaviour case at vet school where they'd been called out to see a cat that started urinating in inappropriate places all around the house. And the owners were like, it's an indoor cat, nothing's changed, we don't understand why it's doing it. And they worked out that somebody across the road, a couple of floors up, had gotten a new cat, and this cat was looking down on the territory, and that's all it was. And I think they kind of asked them to pull that curtain or something, and they sorted it out. But it can take digging to things that you don't think are stressful.
And to consult with a behaviourist if you're not winning potentially. Yeah. But I think, we are definitely getting more and more aware. I mean, we are even within practices, establishing cat-friendly practices, separating, more properly separating dog and cat wards, different consult rooms. I mean, we're going to extremes now in order to try and minimize the stress within practices as much as we can, given the facilities. But I think, definitely within a household, like you say, new additions, like people have families, so a new baby might even be the thing that sort of sets it off. And
a dog.
It's a dog, a cat, another cat, change a diet.
Workmen, haven't worked in the house, noise, dust,
Yeah. So if you are, let's say you're having a baby, what are the kind of things that you can put in place if you've got a cat that is potentially sitting with that dormant virus? What are the kind of things that you can do in terms of, are they pheromones, are they drugs? What are the kind of advice from a veterinarian's perspective?
Yeah, I mean, there are some studies being done on both the pheromone products and some of the other products that work to increase certain neurotransmitters in the brain to show that they are successful in reducing stress behaviours, so both in dogs and cats.
Yeah.
So it's definitely worth thinking about instigating these things well before the baby comes. And any changes that you want to make with regards to, for example, where the cats have access to, you want to do that well in advance of when the baby arrives, just to try and make things as familiar as possible.
Definitely. And I mean, that goes a long way. I mean, even in terms of, you talk about the cat inappropriately urinating, that spraying thing is a typical sign of stress. Some of those, the products that you can plug in and the pheromone diffusers can make a big difference, even in what I would consider like quite stable households. But any cat interaction, I mean, what is your feeling on, cats being social beings?
Depends.
I mean, you've got two.
Yeah.
And they love each other.
I've got two, but mine are siblings, so they're sisters, and they've been together since they were born. They have the odd wee tussle, but they get on great, I think. And I had two cats before. My husband had a cat when I met him that was about 2, and then decided that we'll get a kitten together. I want a kitten for me. And our lovely cat, who loved us and loved everything, hated us. Hated the cat, hated us. Wouldn't even let us touch him. He was so upset. And eventually kind of started to come home, and they'd be like at opposite ends of the bed, and then they would be closer, and then they'd be closer, and then they'd be play fighting. And those two cats ended up being the best of friends, and they both lived till they were 17, so there's only a couple of years between them. And they were the big boys together, never got in any fights with each other or anyone else. So it all worked out fine. But during those first few months, I thought, we're actually going to have to give the kitten up, because it was really bad. But we had quite a small house at the time, and I think there wasn't really the space to allow the cat that was already there to have its territory. So that was a long, long time ago, way before I was a vet. But in hindsight, it's a great thing. Yeah. But it did turn out okay, but it can be quite stressful.
So as much as possible, give them space, give them their own litter trays, and over time they may actually become more comfortable in each other. Yeah. There is hope.
And then over the years, I've done that a few times. I've had 2 cats and then a dog, and then a dog and then cats. And it's been fine because we've done it slowly, had more space. Yes, it's always been fine. But there's always that period when you get a dog and you've got cats, or you get a cat and you've got a dog, where you've got to be really careful. Because it's usually the puppy's eyes that will be...
So talking about eyes, we were talking when we were discussing the subject about some of the secondary things that you see and how you have to manage it. So you made mention of the fact that you might see some conjunctivitis, you may see some sequestrum, you might see ulcers. What is actually happening there? I mean, in terms of, and how are you managing those cases?
Yeah, so sometimes the sequelae will be that they'll get dry eye. In cats, if they get dry eye, they're often more prone to getting ulcers. And the type of ulcers that they often get are called dendritic, so they're often like little lines across the eyes. And cats can be really hard to put lubricants in, so like most dogs will let you put lubricant drops in their eyes multiple times a day. Cats, depends. So that is obviously a part of the treatment. But if the gland is not making enough tears, then that's a really difficult thing, like long-term to fix. So some cats will need antivirals. Some cats will just need lubricants. They may need antibiotic drops if there's secondary bacterial infection. But sometimes over time, they will develop a thing called a sequestrum, which is a kind of like a hard, opaque part in the dark coloured part of the cornea, which is really painful to them. And that can sometimes require either really long-term medical management or sometimes a surgery by an eye surgeon to try and fix.
So, I mean, what starts off with sort of cat flu and very sort of typical symptoms can progress to something quite serious and require surgical intervention. So, in terms of these snuffly cats as well, we said that the ability to taste and smell is obviously dependent on that part of the the cat. They're quite reliant on smell, aren't they?
Yeah, very. And if they can't smell because they've got a blocked nose, then chances are they just won't really eat. They also like to breathe through their nose. They don't like to breathe through their mouth. So that's a problem as well.
It's actually a big problem when we see cats come in and they're open mouth breathing. It's it's quite serious. So they actually do try and that's why you hear that turbulent airflow and they get that snotty discharge. Is that right?
Yeah, they try super hard to breathe through their nose even when they really can't breathe through their nose.
It's horrible, isn't it? So in terms of, you were saying practically for owners, do you generally have to support them in hospital? Do they go so inappetent that they actually need that kind of supportive care? Or you said some of the strategies that owners generally start with at home as to provide maybe food that's more palatable. So take us through the various stages from what you suggest to owners, and then if they're failing that, what you may need to do if you have to admit them.
Yeah, so I suppose if you've made them as comfortable as you can, so if you're bathing their eyes, taking the discharge away from their nose and things they'll let you. And you've already tried, increasing the palatability of the food, warming it up, maybe changing what you're offering. And they're still not keen on eating. Next stage is probably some kind of appetite stimulant, which we can either administer at the vets. Sometimes we'll need to do it there, depending on if it's a tablet form and if they can get it in. In the UK, there's also a transdermal gel that you can use to to give an appetite suppressant that way rather than trying to give tablets to an inappetent cat.
A lot
can
easier.
Be a bit of a challenge. Sometimes it'll be kind of anti-sickness meds, which again could come in injection or tablets that are now licensed for cats. And then after that, the only way that really you can provide nutrition to a cat that's not taking anything, particularly if they have nasal disease, you can't put a tube, down their nose. Plus, it has to be so tiny for cats. It's not really that done that often. Would be an esophageal feeding tube, which just bypasses all the nose and the mouth and allows us to feed them into a little port through the skin and the neck. And the owners can actually do that at home for a period of time if it's required as well. And you can give oral medications that way just by giving them down the tube. Downside of that certainly is it's a surgical procedure, so they have to have a general anaesthetic. And there's risks of that as well. Either not being placed correctly, dislodging, blocking as well. So
even infection.
Infection, yeah. I have seen that happen as well.
And then these tubes, how long do they tend to stay in? Because I think, obviously from my time of treatment, they had to stay in for a period of time.
Yeah.
Can they be pulled if, say, they start eating on their own, or is it safer to keep them in, even if they're eating on their own, just because they do fluctuate so much with appetite?
Yeah, you can keep them in if they're eating on their own if they're esophageal. And then once you're kind of convinced that they're well, we would remove them, usually after a couple of weeks, but just kind of dependent. And
owners are quite compliant when it comes to doing that. They're quite...
it's not that common that we do it, and we'll have them in the hospital, certainly, and I have sent some home and had the owners using them. But it's not that something I've done loads. So,
there's quite a process. Even just thinking back from, flushing, administering food, flushing again, making sure that you're maintaining the site.
Yeah.
How well do cats tolerate having these?
Usually pretty well. The worst thing they'll do is try to scratch at the tube or something like that. So you usually have that just kind of bandaged in. Some cats will need a collar. But again, I've had them sent home before when they've just been great about it. Depending on the cat.
Yeah.
And the owner, whether they're willing to do that and able.
Yeah. And why nutritionally? Why are you supporting these cats? Obviously, they're not taking it in because they're inappetent or they're struggling. But why is it important that you're providing adequate nutrition?
Because if you're not ingesting food, then you're nutrient deficient, you're energy deficient. And if you're not getting enough protein on board, then again, you're going to struggle to get better. So it's difficult to make an appropriate immune response if you're malnourished. So and the other thing is with cats, if they don't eat for a prolonged period of time, they can end up with other secondary conditions. So they can get a kind of fatty liver, which then may or may not be treatable.
Yeah.
As well. So you're trying to avoid these other serious complications that can happen if they don't eat.
Definitely. And some of the things, obviously, we've spoken about the extremes from the owners being able to try and get them to eat at home to us going via surgical means to insert a tube. When is it that they sort of generally get admitted for, say, fluid therapy and that kind of treatment? So is that something that you're quite proactive about, or is that something that you give a bit of time to see how owners are coping?
It's partly dependent on the owners and how they feel. My feeling is that one of the things that's going to make them feel a lot better, really pretty quickly, is intravenous fluids, if they're even just the slightest bit dehydrated. So if they're not eating and drinking, then we would tend to admit them sooner rather than later to try and get them feeling as well as they can, instigate the medications, ideally intravenously, to get them eating early on. Because if you miss that boat, it's really hard then to get them rehydrated and started on their medications and things. You're kind of you're playing catch up then.
And how often are they pyrexic? How often do they have high temperatures with these viral infections? Are some of them?
It depends. It depends on whether there's secondary bacterial infection as well. It depends on what stage of illness that the owners brought them in. They also might have spikes of temperature. So cats are well known for, you take its temperature, it's normal. You take it a little while later, it's got a big spike. So you're it's not necessarily in the 15 minutes or so when they're in your consult room that you take the temperature and it's obviously high. It doesn't mean it's not spiking like the rest of the time.
And it's another reason why they can go off their food, obviously.
Yeah.
And then, we were talking about the progression of it. So not only are you worried left untreated that these cats can get a pneumonia, which is not necessarily common, is it?
No.
But this recurrent rhinitis you talk about, what is that? Just for for owners that are not familiar.
So they often will have sort of secondary bacterial infection as well, which you can just never seem to get rid of. So they've got this, the actual nasal turbinates and things can be affected. So over time, the whole inside of the nose is abnormal. And so the normal clearance of the mucus within the nasal passages is abnormal. So once it's kind of dry and not correct, it just means that there's much more likely to be secondary bacterial colonisation of that, and you can just never really kind of get rid of it.
Mm. And are there particular breeds of cats you would think that struggle more? I mean, we spoke recently in a podcast about our brachycephalic dogs. Are they even more susceptible to this because they've got that shortened face? I mean, and those eyes that are kind of more protruding.
I think any animal that already has a narrow nasal passageway, narrow nostrils, like the like you say that the cats like the Persians and things like that are already kind of tend to have smaller nasal passages, they're going to struggle more if they get a bit blocked up. But I don't know if particularly I noticed a breed susceptibility. There might be some, but I haven't personally noticed.
And then we were talking yesterday about the cats and what happens in their mouths. So, we obviously within a clinical examination, we're doing that whole, head to tail look. And there are a lot of things I've alluded to before for people who have listened to the podcast, that owners are not even aware of the things that we're checking, even from when you're looking at them, like we're talking cats now, not necessarily dogs, but you're looking in that cat carrier, like what is the respiratory rate? We're picking up subtle cues that we get familiar doing over our career, to as they're coming out, you're feeling them immediately from a body weight perspective and body condition scoring them and so on and so forth. I mean, giving some examples, but, when we look, owners often don't even see us looking in their pets' mouths because we're talking,
Yeah. And they'll say, but you didn't. I did.
I definitely did.
I've numerous times I'm like, you haven't given him its vaccination. I'm like, I have. I've just done it. This is just because they're talking and because the cat hasn't reacted, they think you haven't done it. I'm like, look, here's the needle, here's the thingies. Definitely did. So I think again over time as you become more experienced, you probably slightly slow down. And I often describe what I'm seeing to the owners as well, even if they're healthy, just so they know that you've checked. So his teeth are fine, or he's got a little bit of calculus starting on his teeth, or whatever. So as you're checking, they know that you're clocking it.
Yeah.
So you might see certainly in some of these cats with cat flu, you might see ulcers in the mouth, and that's something obviously that will affect their appetite. And that'll be painful as well. So we would want to think about analgesics as well, like as part of a pain management plan.
And they're obviously a lot less likely to want to take on food and crunch food, particularly, dry food or whatever. So they can really, people don't even realize because it's not something you generally do is look in your cat's mouth. I don't even know if my cats are home, for the dogs, they might hang their mouths open and be panting or whatever. You get a better view than with your cats who sit with their mouths closed. So owners often don't realize that there's some ulceration or discomfort there. And do these ulcers just generally sit in the mouth? They don't extend down? They're not sort of ulcers that affect the esophagus and the stomach?
Yeah, as far as I'm aware, it's just the mouth. With other things, who knows? Yeah. They might go right all the way down.
It tends to be a bit more sort of upper respiratory.
I've never even seen them I don't think they get like a stomatitis thing. I think it is just tongue.
The tongue or under the tongue. Yeah, not so much even on the gums, hey?
Not that I've seen. But I'd have to look that up to tell you.
No, all good. So I think, from a, clinical examination perspective, you've clocked the eyes, we've looked in the mouth. You're obviously also listening. What are you listening for when you pick up that stethoscope?
Well, so even before you pick up the stethoscope, you're listening to the upper respiratory. Like if there's an effort, you can hear, obviously, are they breathing through their nose? Are they trying to breathe through their nose? Is there a harsh kind of noise up here? And you're listening for any noises that are not normal. So in cats, when you listen to their chest, in a normal cat, you hardly hear anything. It's really quiet. And in the same way, when you watch them breathing, their chest can hardly move. And sometimes you're like kicking and going, is it actually breathing? Is it okay? You poke it, check it's okay. So with the stethoscope, you're listening for any adventitious noises. So any crackles, any wheezes, or just indeed increased respiratory noise, for that like increased noise through through the airways.
So, we spoke about the importance of nutrition, and I totally agree. Obviously, it's my love,
It's your bag.
It's my bag. But when you are assessing these cats, how are you doing so from a physical examination perspective? What are you doing, particularly in cats, because it's a little bit different to dogs, to body condition score them?
Yeah, so it's only a little bit about what they look like. And to be honest, when anything's floofy, you can't tell whether it's overweight or not. And then you can weigh them, which obviously gives you a number which you can look at, and that's good for monitoring that individual through time, but it doesn't really tell you anything about that cat as an individual, because I could have a normal cat with a nice body condition score that could be 3 kilos, and I could have a big Maine Coon or something that's 8 kilos and it's still not overweight. So it's very individual. It's more what they feel like. So if they are short-coated, you can see the shape of them. So that's part of it. So you see whether they've got a big hangy belly or whether you can see their bones sticking out. But mainly it's palpation for me. It's what they feel like. So can I feel that they're muscular? Can I feel that there's that the bony prominences are poking out? Or can I feel that they've got like a lot of subcutaneous fat like over the ribs? Like I have to really squeeze my fingers in to actually feel the ribs. So I'm just feeling them kind of all over. Muscle mass, you're trying to assess the fat mass as well.
And I mean, the kind of ones that have got a little bit of excess are probably the best case scenario. The very thin ones when they get cat flu, and the very obese ones are the ones that you particularly worry about. Is that correct?
Yeah. And any young animal, so all the kittens, for example, are obviously just naturally skinny. They are quite thin, and that's normal, for them. And they also don't have such a good ability to generate glucose from their liver and things. So they can struggle to maintain their blood glucose if they become unwell and they're not eating.
Sure. Yeah, good points. Those are the ones that generally need blood glucose monitoring and a speedier intervention because they're so small. So so we've spoken cat flu. We've said obviously the things to look out for, the consequences thereof. People obviously don't want this. Let's talk about the importance of vaccines, because I kind of leave it to the end because I think there is probably a bit of a misconception out there that vets just want to vaccinate, and there's a lot of fear around vaccines after our whole COVID experience. So how do you generally explain this to owners in terms of the importance of vaccination and the fact that a lot of these diseases are preventable?
I think with regards to respiratory disease in cats, when such a high percentage, I think it's like maybe over 80 or 90% of the respiratory infections that cats get will be caused by the viruses that cause cat flu. You can obviously prevent such a massive amount by vaccinating. They've also been around for such a long time, and that's a big thing, especially if you're comparing to COVID vaccines. We've been doing this for such a long time, and that they have a good safety profile. So we kind of know that the cats that are vaccinated are going to be well. With any vaccination, there is always a risk. So there's always a slight possibility they will have a vaccination reaction. I've only seen, I think, 2 in cats in nearly 20 years. So versus the cat flu cases and the sequelae that I've seen, it's, to me, a risk worth taking. And I've always vaccinated my cats, every year, all of them.
Because I think, and I'm talking even from experience, there's a lot of hesitation to putting your cat in a cat carrier and going into the practice. It seems that, from an uptake perspective, dog owners thinking that they're taking the dogs out, or that there's more risk, or maybe the discussion on, particularly in this country, about rabies and parvovirus. We see a lot of cats that do not maintain their vaccination sort of schedule and status. And obviously we see these breakthroughs, but particularly because we do have a population of strays. And then we do have a lot of welfare organizations that take care of these stray cats and then try and rehome them. And everybody wants to be able to give a needy cat a home, but there's obviously caution in terms of how you introduce it, as we discussed earlier, but making sure that they are vaccinated, because it does make a big difference to these lives.
Yeah, and even if you're anti-vaccine, to attend the vets on a regular basis is how we find out all the other things that we can treat and try and prevent. So it's not just, to me, like I have not many, but there's a couple of clients who like, I actually don't want to vaccinate. Maybe they did have a prior reaction, or that there's some other reason why they don't want to. I would still be like, still bring them in, because you can still have a sensible discussion about whether that is or not the right thing. And also, like I say, we will pick up other things, particularly in the cats as they get older. So the clinical exam and the history taken is often just as important.
Definitely. For the owners that are obviously also concerned about the overuse of antibiotics, can we have a discussion about that and of the fact that, you know, us as veterinarians are very mindful of our use of that? Is that something that you face a lot?
I find more often it's that people want me to give antibiotics, and I'm like, no, I don't want to give antibiotics, because it's actually not likely or not a bacterial infection. I think there's been a move, obviously, in human medicine with regards to, you know, overuse of antibiotics and inappropriate use of them. And in the veterinary realm, the same thing. And certainly now there's much more awareness than when we graduated, like at home in the UK. We're very much like, well, we have a kind of cascade, we have a kind of plan, what and when we should use antibiotics, which ones we definitely shouldn't use without a culture and sensitivity, etc. So there is definitely a move to either not using or just keeping them in reserve for when we know that that is the right antibiotic, you know, for the job. So I think a lot more focus needs to be on the symptomatic care, you know, whether it's a diarrhea that you don't think is, well, again, if you think that's a viral infection, you're not going to give antibiotics for that. And there's a supportive care for that as well. So I give out not very many antibiotics for those type of things at all.
But also you're explaining to your clients, because you have a relationship, you can explain.
Yeah, and
this
that's
is not
the thing.
appropriate.
So it's about the trust, and it's about that understanding that, you know, if antibiotics were going to fix this and that was the right thing, then I would be giving you them. But it's not. So a lot of the time we wouldn't give antibiotics and for a lot of these things.
Yeah. I mean, you spoke about the fact that, you know, our cats, they come in, you know, if they, off their food, they have a diarrhea, for example, they may need to be admitted to a hospital. And I'm going back to people going, well, my cats don't go anywhere, so they don't need vaccines. They may need to be admitted to hospital. And as we spoke about right at the start, some of these are asymptomatic, meaning that they are not currently showing signs of cat flu, if we were talking cat flu specifically, or any viral infection for that matter, that they are now at risk. So I think owners often don't necessarily think through potentially the periods of time in their cat's lives where they may be vulnerable. And they are now, like you said before, immunocompromised in terms of they're ill with something else. And they may be coming into a practice. And obviously we do what we can. We have separate facilities. We have isolation wards and things. But that is something that...
That is a real risk. And it's the same as if we go into hospital, you know, nobody wants to go into hospital and catch another infection, but that it happens. So you can do your best to prevent these things. And one of those things is just to be vaccinated, to have that immunocompetence before you go into hospital, to lower the risk of them catching anything.
So when would you start this vaccination? Obviously, let's talk, you're going to get a kitten, assuming that you've got it from a reputable breeder or rescue organization, or they've maybe provided one or so. What sort of age are you starting vaccines against cat flu?
It's slightly dependent on the manufacturer. So we tend to vaccinate from 8 weeks. So usually 8 to 9 weeks would usually be the starting age. There is obviously some interference from maternal antibodies if they've been with their mum and been fed by their mum. But a lot of these kittens, that's maybe not the case anyway. So you just want to make sure that you've got your kitten, that it's fit and healthy, it's got nothing else wrong with it, and it's old enough as per the manufacturer's instructions just to start. And I think if I rescued a cat and it wasn't vaccinated, although a lot of the shelters obviously will already had done that, I would want to have it for a couple of weeks to make sure it wasn't ill with anything else before I then got them vaccinated. But I would take them for a checkup regardless to make sure that there's nothing else that I should be doing something about.
And then vaccinate them if they're fit to do so.
If and when it's the right time. And obviously your vet would give you a bit of an inclination as to when that would be.
And I know we touched on this before, but in terms of the other, so we've spoken about cat flu and things, but there are other viruses that you vaccinate against, or that you certainly check if you're concerned about them being immunocompromised. Can you just provide some clarification on the other ones that you made mention of?
Yeah, so we vaccinate against feline leukemia, and that vaccine I would only normally give to cats that are either going outdoors or that are in contact with other cats that are going outdoors. So if there's any doubt that that might be the case, we tend to give it, because often what will happen is they'll be rehomed to someone it's going to be an indoor cat, and then that changes.
Yeah.
So you can blood test for that, and obviously it is something that we can vaccinate against, so I would recommend that we do, because the sequelae of that, you can't treat it, and it can result in lymphoma. So yeah, that's a big one. The FIV, which we can also test for, and there's no cure for that, and there's also no vaccine for that. So the main way to avoid that is that they don't fight. And they're less likely to fight if they're neutered or they're indoors. So
yeah, definitely. So my parting question to you is something that was asked, and I can't even remember who asked us this question. And I'm asking it again because I can't actually remember your response. I just remember laughing at my response. What is the hardest, your son, Lucas, what is the hardest animal to treat? But it probably is the cat that's already upset before you get your hands on it. Because with dogs, you can usually win them round, or you can persevere to a point. But if the cat comes out of the box, or you can't get out of the box, and it's decided, no, that's it. So we tend to try to anticipate that. So for routine appointments that we know if the cats are nervous, we tend to offer medications to give at home to try and relax them. And you can also use pheromones and things like that as well. But sometimes we'll give medications to chill them out before we try and do anything, particularly for blood sampling. We know we have to blood sample them. So it doesn't totally sedate them, but just enough to help with anxiety and just make it a nicer experience for everyone, the owner, the cat, the vet. Yeah. That's got to try and do that. Yeah. So you would encourage these owners, if they feel that this is going to be a really awful experience, to speak to the vet. There are things that we can do to make it a more pleasant experience, because it's needed. There's sort of more than just vaccine or even discussion about not having the vaccine that they gain from having their yearly checkup.
Yeah, so if they're lucky, the practice will have something like you guys are trying to do, where they'll have a cat-friendly area. If not, and you know that your cat is worried, then you can ask the reception, is there a time when I can come where that's going to be more suitable for avoiding the dogs, or, like first time in the morning, is it last thing at night? Like, how can you kind of avoid the trauma that you think your cat's going to anticipate?
Yeah. And obviously, just like, please don't schedule me around, the time where there's going to be a large breed dog. And we definitely getting more and more awareness around the benefit of that. Just, from like you say, the very stressed cat that is very hard to examine and get any treatment into or any diagnosis from, because you can't take a blood sample, you can't listen to a heart rate, you can't even take a temperature. That makes an impossible situation.
And we tend to be very I just have a very kind of kind, hands-off approach, that if you can't do it calmly and it be a nice experience for the cat, then you need to do something else. So you need to either sedate them, or you need to give them drugs beforehand, to facilitate that being kind. So we don't force things on them. We don't want it to be like that.
And your view on scruffing?
Yeah, we don't.
Yeah. Remember the days where it was just normal practice. I mean, even when we were qualifying, it wasn't seen as a bad thing. In fact, they put a twitch on a horse, and it's like, it releases endorphins. I think I had the misguided view that actually it was quite pleasant for them. That's how their mothers would carry them. And those are obviously I would never dream of it. It's amazing how things change over time, but I didn't realize sort of the harm we were potentially doing in our handling approaches. So
less is more.
In all respects, in many respects. Yeah. Thank you for taking the time to chat to me, for braving it. Wasn't as terrible as you.
Thanks for having me.
Yay!
I guess.
Next year, we're already planning our reunions. So we're not going to leave it as long. So next year we'll do this again if I haven't completely scared you off. But I mean, there's a lot of discussion to be had, and I'm sure you sort of see the value in us being able to communicate better with owners. I mean, you're doing that within your consults every day, like you say, communicating even what you're seeing and what you're doing and why you're doing it. And the ability to do that, I think, is really important at a time where there is mistrust in professionals, just generally professionals. I mean, I know that you've got a really good relationship with your clients, and there are a lot of people who will request just to see you. That's the kind of vet you are. So I think if we can do as much as we can to inform owners of our intentions, but also our thought processes, I think it's a step in the right direction.
There's a lot to be said for remembering that when you go to an appointment, you often would write things down or whatever, and the owner is focused on remembering everything they need to tell you, and that's all they're focused on. And then they go there and they tell you. But then by that point, they're not really taking in a lot of what you're telling them because they're just a bit overwhelmed. I think there's a study done. It's like you take in like less than 20% of actually what's said to you in the room. So therefore, I'll often write things down or just some notes or refer them somewhere so that when they go home, they can think about, well, these are all my options of pain relief, because they don't remember what you've said. And I wouldn't remember either. Like I'll go into the doctor's and I'll go, what was I here for again? What would I need to remember? And it's just we're all hyper-focused on what we need to do as our part, and then we forget the other side.
So there might be a good point. If your vet isn't at the point where they have the ability to maybe like write things down, go in with some notes, write things down if you need to, or ask them to go through the information again so that you can make some notes and jot things down, because I think we all do it. I mean, I was sitting yesterday with a parent-teacher meeting, and I actually had to go, hang on a minute, let me write this down, because I'm taking it in the moment, but I know I'm going to get home and go, and then that frustration of not being able to follow through the instruction because you just don't remember. And often in a consult room, it is a stressful environment for owners just as much as their pets. So we can mitigate a lot of that stuff in the way we conduct ourselves. But I think, like you're saying, it's a great tool for us too, as veterinarians too.
Yeah, and it's certainly really nice if you work in a practice where it is a real team dynamic. So the nurses, the reception team, so they're doing everything they can from when the client phones in to afterwards, maybe sending on an email. It might be an estimate for work you want to do. It might be, like say, stuff about these are your options for pain relief, or just gives them a chance to review it when they're not in the clinic. Speak to the partner and be able to relay stuff, because that's often what happens. You end up explaining the thing 3 times to 3 different people. It's much better if you can just do it once and then give a clear kind of plan to the client before they go. Definitely.
And also that buy-in in terms of, like managing their expectations in terms of the finances around it. Because I think, we are always very reluctant to have people back in. And I think one of the things I've realized, and this probably goes back to my question to you, is, for me, the most difficult patient to treat is the one that can't afford the treatment, because, you don't then have the opportunity to say, I'd like to see this cat again. I'd like to see, how things have progressed or improved with the treatment that I provided or the advice. Is there compliance? Is there owner compliance in terms of administering the medication? We all know how difficult it is to follow things, particularly when things are better. Like you'll take a headache tablet when you've got a headache, but you're not going to necessarily take it.
And again, so people are known for, I don't know what the stats are, but the number of people that don't finish their course of antibiotics, for example, for themselves, when it's easy to just swallow the tablet, never mind give it to a fractious animal that maybe isn't going to let you do it. So we have to make sure that what we're suggesting owners do, we could either do ourselves, or that they can manage that. And that's about communication as well, and about making them able to be vulnerable and go, I'm not going to be able to do that. So you have to be able to give the options. And the same thing about finances. If in an ideal situation, you're going to say, I want to do this, this, and this, I want to admit it, I want to do a scan, I want to do full bloods. But if that's not, affordable, then the next best thing is that we do this. And you have to come to an arrangement where everyone's okay with the plan. Yeah. And that's the hard bit.
In the interest of the animal.
That is the hardest bit. And sometimes that might not be that you get to treat the animal. But if that's the situation from the start, you're better to know that, for everybody.
And I mean, we spoke about, and I know we're this is us having a chat, which is great. I love it. We could go on like this for days. But that example that you used of even being clear about the instructions for administration of meds, you gave that the story to us the other day about the miscommunication. Tell us what happened there, because it's a reality. And I think,
that famous one where there's a dog that has a really sore ear. And you can't put eardrops in at the moment because the ear is really narrow and really sore. So you give oral medications to open up the ear canal. So it might be steroids or something to open up the ear canal, and possibly oral antibiotics if there's a horrible infection in there. But the owner had put the tablets down the ear because it was to treat the ear.
Yeah.
So we have to be really clear that everybody understands where to put what.
And including things like we've had some very interesting, and this is not a case of laughing at owners. We laugh because we get it. We understand,
and it's us that needs to be clear.
Yeah, we have to be clear about the instructions for the actual administration. If this is to complete treatment and this goes on the dog, the label has to say this is for the dog, not the cat, because the consequences are grave. And this is where it goes, not that it ends up going in the mouth.
Because some flea treatments are oral and some flea treatments are on the neck. So again, it makes it more difficult.
Yeah, so true. Thank you for your time and lovely chatting.
Thank you.
So nice to have my best friend on the podcast. Dr. Dawn, are you going to be going back to practice, back to work, back to reality?
Yep, next week.
So wishing you all the best with the change from holiday mode to life.
Yep, it's all good.
But thank you. Thanks.
Cheers.
Thank you so much for tuning into today's episode on the Paws Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Oh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.